Hi everyone, very good evening guys and welcome to this YouTube live session. Now with very few days, or we can actually count the number of hours that are left for the NEET PG exam, the purpose of this session is very clear and I want to put that point across at the outset. We are going to make this a rapid session. There is no time for 4-hour, 5-hour sessions at this point of time because you have a lot of self-study to do. So we are going to make this rapid, high-yielding, concise and crisp. Before we move forward, a similar session for microbiology will also be conducted tomorrow at 5 o'clock. Second doubt which I'm sure everyone has is what about the PDF? So the annotated PDF will be shared within 5 minutes immediately after the session ends. So do not worry about it. Your only focus at this point of time is forget all your anxiety, all your panic attacks, whatever sleepless nights that you're going through, and just focus for 1 hour, 1.5 maximum on this session, because every question is going to be a potential question that is going to come. So before we start, I want to show you a picture. Do you know this is Sachin Tendulkar when he scored his very first century way back in the 90s. So we are going to start, and you can see he looks so young. So we're going to start with very baby questions, and at the end of the session, this is going to be us when we'll score our 100th century, right? So every question that we are going to pick up today is going to be very, very important. Now what is my role? I am not going to be at the striker's end. All of you are going to be at the striker's end. You are going to give me answers. I will be at the non-striker's end supporting you score that century. Okay, so let's get going. So everyone, forget the anxiety, the panic attack. Let's get together and finish off one subject in as quick a manner as possible. Let's start, as we said, baby questions. Okay? So baby questions, first and foremost, 100 one-liners, starting with the first one. What is the necrosis that you see in solid organs and its pathology? I cannot only focus on questions to do with one-liners. Now, images will come alongside. So first and foremost, that is necrosis in solid organs, of course, is going to be the coagulative necrosis. So if you get any question which is to do with the kidney or the heart or the liver, any of these solid organs, that is going to be the coagulative necrosis, right? So heart attack ka history is very common that you'll get. And what are these pink cells that you're gonna get? The pink cells in coagulative necrosis are said to be the ghost cells. Hai na? Everyone remembers it. Amazing. So the start is very, very good. All of you know about it. Moving on to the next. What is the necrosis that you'll see in organs like the brain and pancreas? They are also solid, but they don't show you coagulative necrosis. What is that going to be? Amazing. The other picture that we have is examiner ka favorite. Inke paas, this is the only picture of liquefactive necrosis that they have. We all know it. So either you can call it liquefactive, very good. All of you are even telling me the other name, colliquative necrosis. So brain ya pancreatitis ka history aayega. I'm going to talk about this liquidy area, that is liquefactive necrosis. Very, very good. Now coming to the next one. Three alphabets wala things. Polyarthritis nodosa, rheumatic heart disease, SLE, hypertension, malignant hypertension. All these three alphabet things show you what? Amazing again. Everyone can see ye jo pink color band hai. Amazing. So that is going to be the fibrinoid necrosis. Now I will be talking about these individually also. Gradually we'll be getting onto systemic path. So every disease will come one by one. So the start is very good. We've done the 3 type of necrosis. Jaldi, and we've revised the pictures also. One quick question. If I get a case of PAN, polyarthritis nodosa, which viral marker will be mentioned positive in microbiology? Come on, you guys know this. And that is HBsAg. The question will always start with excellent. So now we are working on telepathy. I saw Dr. Sayanthani mentioned hepatitis B before I asked. So we are working on telepathy. You know what is the question that I'm going to ask you. Super duper good. So ye wala question ho gaya. Let's move on to the next one. After necrosis, you have to go in for apoptosis, necroptosis, pyroptosis. So what are the questions that you'll get? What is the Ratta question? The Ratta question is the caspase numbers. So can you quickly tell me, for apoptosis, what is going to be the caspase number? When I talk about initiators ke liye you had to go in order 8, 9, 10. Very simple. 8, 9, 10. Out of them, how many of these are from extrinsic pathway? 8, 9, 10. So everyone has told me correctly. Extrinsic pathway kaun sa hai? So the way you write extrinsic pathway, do you remember? Extrinsic pathway had E and X means 8 and X means 10. So these two are going to be from the extrinsic pathway, and automatically the 9 comes down to be intrinsic pathway. Super good. When these ratta things start coming to your mind so easily, na, it should give you a lot of confidence that when such ratta things are coming to my mind, I am able to recall, then concept so I will be able to apply very, very easily in the paper. Coming to the next, what are the executors? They are also almost in order. 3, 6 and 7 are the executors. So before you answer that, tell me out of this entire list which is the most important caspase that we have. The most important caspase is this chota number. The smallest number is the most important caspase. Super duper good, very good, going well. Moving on to the next, quickly tell me, that's a trick question. What is the caspase in necroptosis? What is the caspase? No one's gonna get this wrong. I know you guys know this very well. You know the trick that I've played. Ma'am, there can't be any caspase over here because necroptosis is caspase independent. Perfect, it is caspase independent. So you possibly cannot have any caspase mentioning. But if the examiner wants to play a little more smart and ask you which procaspase inactive form can be there, so procaspase 8 ho sakta hai, but look out for this word, it can be procaspase. Inactive form is acceptable, but the active form is not acceptable. The definition is only it's a caspase independent type of death. Super good. Coming on to the last one, pyroptosis. We are expecting a question on this because this is a Robbins 10th edition update. All of you know, yes. What is it for pyroptosis? 1, 4, 5, 11, because this entire list is updated in Robbins. 1, 4, 5, 11. Out of these, so what are these? These are caspases 1, 4, 5, 11. Which of them can cause fever? Fever wala kaun sa hai? So you will say, ma'am, fever is caused by interleukin 1. And who will activate interleukin 1? Caspase 1 will activate interleukin 1. Simple hai na? 1 for 1. Interleukin 1 will be activated by caspase 1. Super good. Everyone's got it right. And I'm getting some extra answers also which I'm reading and they're all right. So that's good that you're able to recall everything alongside also. Chalo, the second slide is also done. Can you tell me quickly the answer to this question? What is the most common metaplasia? I see a lot of students faltering here. You know the answer, but sometimes kuch problem hota hai. What is that? Most common metaplasia is said to be squamous metaplasia. Most common metaplasia is squamous metaplasia. Which organ are they talking about? Amazing. They are talking about the lungs. So lungs mein squamous metaplasia means what? So I'll quickly write because typing for you will take time. Ciliated epithelium to normal hai. Every lung has ciliated epithelium. That is gonna change into squamous epithelium. That is what is squamous metaplasia. Reminding you once again, terminology of metaplasia is end result matters. Abhi to you're in your NEET PG end days na, so you know it's ultimately what is the end result. MCQ solved or not solved. End result matters. So in metaplasia also, end result matters. That is how you will name it. In the end you get squamous epithelium. How? So one to is obvious. This will happen in smoking, right? But which vitamin can be associated with it? That will be your question. Smokers to sabko pata hai. Vitamin A. Vitamin A is also associated with it. Excellent. Some of you in between said Barrett's. Dekho, Barrett's is a metaplasia. I agree with you. Barrett's is our favorite metaplasia. Barrett's is examiner's favorite metaplasia. But Barrett's is not the most common metaplasia. But you're right, it is a type of metaplasia. Correct. Moving on, give me an example of mesenchymal metaplasia, again which students don't study too well. Mesenchymal means no epithelium happening. Mesenchymal happening. What is that? Super good. That is excellent. Myositis ossificans. Great, guys. And myositis ossificans mein to word is only telling me everything. The myo is telling me that the muscle is there and the ossificans is telling me that the bone is going to be there. So it's a muscle to bone transition. Mesenchymal. No epithelium over here na. So this is a mesenchymal metaplasia. Example. Very, very good. This is also done. The next topic that I'm going to take you to, so many students told me, ma'am, ye please revise kar lena. And that is, what is the role of sirtuins? This came in the FMGE exam, this came in the INI-CET, you know it is going to come somewhere in this paper also. So what is sirtuins, guys? Yes? What is sirtuins? So sirtuin, we know one use. Sirtuin is something if I want to look young forever and I want to live for like 100 years, 200 years, sirtuins are going to help me. But there's a very simple way of learning sirtuins and that is amazing. Everyone remembers ABCD. Very good. We had done this way long back in our rapid review. So what is ABCD? When they ask you what are the benefits of sirtuins? Super good. A for number 1 to ye hame pata hai. It is going to help me in anti-aging and you know we will be able to live forever. Others also that I'm getting is great. Treatment of cancers and treatment of diabetes mellitus. Now guys, ABCD तो याद हो गया, cancer, diabetes, anti-aging. They twist the question and they ask you, why does it help in the treatment of diabetes? Anything helping in the treatment of diabetes is what? What is going to be the action or the insulin sensitivity? Of course, it's going to improve insulin sensitivity. That is exactly why it is going to help in diabetes treatment. So this was the question that came in the last INI-CET, that sirtuins help in improving insulin sensitivity and thus they help in treatment of diabetes. What also came in INI-CET was, what exactly are sirtuins? They are histone deacetylases. ये कुछ रट्टा type है that you will have to quickly go through. They are histone deacetylases as enzymes, and the mnemonic we have done ABCD. Very, very good. So now if I have sirtuins, I'm going to live for 100 years. But what about people who have Werner syndrome? Werner syndrome matlab progeria. It is a premature aging. It is a progeria type of a syndrome. This is also a previous year question. So let me know, what is the defect? NEET PG 2019 PYQ. Excellent. DNA helicase defect. Super good. DNA helicase defect. The only concern is, what kind of a progeria is this? Is this going to have an onset in children or is this going to have an onset in adult? So remember that Werner syndrome is also known as adult progeria syndrome. Werner syndrome is adult progeria, means the child at the age of 8 or 10 or 12 is pretty much okay. Problem starts after 15, 16 or 18 years of age. So it's an adult form. So matlab that movie Pa that all of you saw, that did not have Werner syndrome, because in that movie Pa, the character, Amitabh Bachchan's character, dies by the age of 13. So that was a different progeria syndrome that was there. What was that progeria syndrome? Come on, you guys can help me with that question. What was that progeria syndrome? That was Hutchinson-Gilford syndrome. When they say Hutchinson-Gilford syndrome, that is that you will just think of that Pa wala movie, because everything was happening in childhood, everything was happening jaldi, cataract was happening at the age of 8, 9 years. They will ask you, what is the genetic defect? Lamin A. And they are really mean when they give you this question. Options are lamin A, lamin B, aisa ABCD type they do. Okay, so remember lamin A is the one that we had in Hutchinson-Gilford Pa wala movie, right? Coming all the way back, so you are done with the most important questions of sirtuins and Werners also. Sounds weird, you've done Hutchinson-Gilford. So as I said, although they sound like, why did I say 100 centuries like Sachin Tendulkar? Because every one-liner is going to be a century in its own. You will be covering a short topic in it. Let's move on to the next one, guys. You have a long way to go in this slide. Cellular events of inflammation. Come on. Cellular events of inflammation, everyone remembers that mnemonic, the very famous mnemonic known as MRAT-COP, है ना? MRAT-COP, very, very simple. तो अब one एक एक करके you answer it for me. What is with M that you have? पहले तो you guys have to tell me M is going to be, so I won't write it, ये सबको पता है, amazing. This is for you to write. Like I said, I am at the non-strikers end today. M क्या है? M is margination, very, very good. M is margination. What is next? R for rolling, perfect. Rolling. A for adhesion, T for transmigration, then chemotaxis, opsonization, phagocytosis. This to everyone knows. I will now ask you details. Details are going to be question number 1. Rolling is because of what? Rolling is because of what molecule? So rolling is because of selectin CD62. Rolling is because of selectin. Can you tell me what are the 3 types of selectins? Jaldi wala revision. A lot of cricket happening in today's class. English Premier League. The 3 types of selectins are E-selectin, P-selectin, L-selectin. E, P and L, these are the 3 selectins. 62. Perfect. Excellent, guys. Next question. Adhesion is because of what? So now in all that MRAT-COP, I'm asking you one question. MRAT-COP is what? What is adhesion because of? Amazing. Adhesion is because of integrins. Super good. Integrins are of how many types? Integrins are beta 1, beta 2. You know that if you're telling me these molecules, soon ma'am is going to go on to diseases also. Yes. So normal batao, then diseases batao. Okay? So go on. Integrin, beta 1, beta 2. Perfect. Moving on to the next one. The question that has come 1 million times in NEET PG earlier, transmigration is because of, either they will call it transmigration or they will call it diapedesis, and that is because of PCAM. It is because of PCAM1. PCAM1 ka CD marker CD31. As I said, 1 million times this question has come, CD31 or PCAM1. Coming on to the next question, what are the chemotactic agents that we make endogenous? We make them ourselves. So we are going to make LIC. Jaldi LIC ka full form bata do. What are the things that we make for chemotaxis? What is chemotaxis? Attraction. So what are the things that we make for attraction? Number 1, we make leukotriene B4. Next we make interleukin 8, and very good. The most controversial, anyway told me it is C5A. It is C5A that is going to be LIC. Very, very good. So AA wale, very good, Dr. Ramkesh. You said AA. All the AA wala things like C5A, C4A, C3A, these are the ones which attract. These are the A for attraction. Amazing. If I've asked you chemotaxis, of course, ma'am, next we know telepathy. You will ask me 2 questions on opsonization. So tell me which is the most important opsonin, the best opsonin that we have. The best opsonin is IgG. IgG immunoglobulin is the best opsonin. But if I change the question and I ask you the best complement opsonin, now your answer, very good, C3b. So what did you gather? Now all of you told me, pehle hi bata diya. Like I said, na, today's session is so easy for me. All of you are so learned and you know pathology so well, so I can pretty much sit back and chill na today. All the AA wala things are gonna be for the attraction, and all the BB wala molecules are going to be for opsonization. Very, very good. So this MRAT COP ka main questions are sorted, but if you thought that it was as easy as this, no. Now you will tell me sabka 1111 disease, ठीक है? Let's get going. So you have to tell me the defect. Jaldi se 1-1 defect, 1-1 clinical feature revise kar lo. So all your questions are done. ठीक है? Deal. 1-1 defect, 1-1 clinical feature. Get going, guys. The first thing, LAD1 and LAD2. तो simple. Defect क्या है? Oh, very good. I've got answers already. LAD1. I जैसा. But which integrin? Please complete that. It is beta 2 integrin which is going to be a problem. And साथ साथ tell me the clinical feature also. ना अभी we don't have time after this. I don't think anyone's gonna get back to pathology. तो जो पढ़ना है फटाफट finish it off today only, right? So what is going to be the problem? There is an umbilical cord separation problem. There is an umbilical cord separation or a shedding off problem. Excellent. Separation defect. Coming to the next, LAD2. Ma'am, the way you write 2, we will split the 2 and that is going to be Cialin-Lewis X. Very good. Cialin-Lewis X के साथ very famous blood group. Very, very good. It is going to be the Bombay blood group. Great going, great going. So simple. Umbilical cord का problem आया, I will mark LAD1. Bombay blood group आया, I will mark LAD2. Done. What is the next disease? What is Bruton's hypogammaglobulinemia? Very simple. Hypogammaglobuline matlab IgG is gonna be low. IgG is low. Can you tell me the defect? BBB. Remember Bruton was what? Sab kuch BBB. So if I ask you kaun sa gender, you will say this will happen in boys. Very good. And everyone said, ma'am, we are not typing. हमें पता है. BBB. Very good. One is going to be boys. The other is going to be which cell is going to be defective? It is a B cell defect. And कौन सा gene? Bruton gene. It is a BTK gene problem. तो simple ना. We have boys, B cell, BTK, Bruton. सब BBB होगा question में. I will mark Bruton. Super good. Coming on to the next one. Shediac-Higashi syndrome. What is that one hair finding? If that word is mentioned, you know they're talking about Shediac. बच्चे का बाल will be what? Silvery grey. If they say there is an element of albinism, classical silvery grey. Classical silvery grey hair mentioned in the question, you know we are dealing with Shediac-Higashi. The only question that they'll ask you is the genetic defect, and that is list. List is the gene. List matlab lysosome problem. Lysosome, phagosome, phagolysosome. वो पूरा phagocytosis वाला problem is going to be Shediac-Higashi, silvery grey hair. Okay, the last disease that you have, chronic granulomatous disease, which gets you the maximum questions. Jaldi se tell me 4 questions. Question 1, what is the defect? Chronic granulomatous disease, CGD, there is a defect in the most important enzyme, NADPH oxidase. Very good, NADPH oxidase is going to be defective. Then you will tell me which kind of infections occur. These patients have usually catalase positive organisms, which reminds me, tomorrow we have to do a list. Na? Tomorrow's one-liners will include a catalase, oxidase, urease positive wala story, right? So tomorrow at 5 we have this thing. So chronic granulomatous disease, catalase positive. Jaldi se tell me what is the screening test and the diagnostic test. Do you remember one chota sa story that we did? Screening test means chota bachcha test. Diagnostic means final test. Chota bachcha test was NBT. We had learnt it as Nibba-Nibbi test. It sounds like that, right? NBT is a screening test, whereas diagnostic ke liye we had done DHR. DHR is diagnostic, and NBT, which is sounding like bachcha's Nibba-Nibbi sound kar raha hai, that is going to be screening, right? So yeah, all the 3-letter things, very good. CGD, NBT, DHR, you know what is screening, you know what is diagnostic. Another slide done, right? This is over. Should we move forward? Now pathology hai, to one-liners will never ever suffice, right? We cannot study only one-liners. So one-liners ko thoda we will have to mix with photos also. Jaldi we can look at pictures. Very good. So what is the first giant cell that you have in front of you? The first giant cell is going to be the very famous Langhans giant cell. Iska to I'm not going to ask you the disease. We all know that this is a case of tuberculosis. This is the most baby question I could have asked you in today's date. But guys, Langhans, and I'm very happy no one marked Langerhans, because Langerhans nahi hota, it is Langhans. That's the only place where examiner can catch me. Langhans giant cell. Very good. What is the next one? The next one where you get this round arrangement. What is this known as? This is the famous two-tone giant cell. Abhi to future answers have started coming. Two-tone giant cells are seen in what? Any lipid-related disorder. Any lipid-related disorder, that is going to be xanthoma. Very, very good. And what is this last one? Ye to micro mein bhi aayega. And by now you will say, ma'am, we don't even want to zoom into it because hame pata hai. We know what this giant cell is. This is the very, very famous, it's got these inclusions. This is the very famous Worden-Finkelde giant cell. Just tell me the disease. I'm expecting this question because isi disease par abhi the FMGE exam had a question. So Worden ka ulta M, and that is going to be measles. Abhi recently in the Jan FMGE exam question, there was a question on the 3 C's of measles. Can you tell me the 3 C's of measles? Cough, coryza वाला जो 3 C's होता है, cough, coryza, conjunctivitis. So 3 C's of measles came in the FMGE exam. I am expecting you could get something like this in the next, in your NEET exam also. That is on March 5th. ठीक है, तो measles हो गया, Worden-Finkelde. अब जल्दी से giant cells देख लिया. तो ma'am, tell me the different types of granulomas also. जल्दी let's go through it and do one most important question. So the first granuloma, that you have, जो simple ऐसा straight line होगा, that is going to be a case of Dirk granuloma. You just need to tell me 2 things. Dirk granuloma is which organism? Which organism are we talking about? Which plasmodium? Falciparum. Matlab cerebral malaria is what we are talking about. Super good. Dirk granuloma, plasmodium falciparum. And what is this classical blue wala thing that you have? So for plasmodium falciparum, we have something called the field stain. For plasmodium falciparum, we have the field stain. Ho gaya, khatam, falciparum, Dirk granuloma, field stain. The next one is everyone's favorite, looks exactly like a donut, and donut mein se you will draw one line out of it. So that is the donut granuloma, seen in which condition? Donut mein se line banaya, it is seen in Q fever. Q fever, very good. Tell me one quick question, I'm not writing it, you know it. Organism bata do. Q fever ka organism, it is belonging to which family? Perfect, Coxiella. You, as we said, we are working on super telepathy today. So answers are coming like I've first time seen answers are coming before me asking. Otherwise, YouTube has a lag, and I'm not having any lag today because you know what to type and what to put out. Very good. So Coxiella ke saath there is going to be Q fever. Any drug, AIMS exam previous year question, any drug which can cause it, that is going to be allopurinol, also can cause donut granuloma. Coming to the last one, what is this, guys, where it's looking like a nice little star? Ye kaun sa wala hai? Amazing. Stellate granuloma star. Tell me 2 infections and we wrap up this slide. One is known as a cat scratch disease. Very, very good. And dusra, One more. After cat scratch, what else? Great. Lymphogranuloma venereum. Sorted. Granulomas bhi ho gaye. Cat scratch and LGV, they show you a stellate granuloma. Amazing. Done. Shall we move on to the next one? Again, there's going to be a fill in the blanks. This is actually linking it with surgery also. When we are talking about wound healing, you're going to do some fill in the blanks for me. Everyone knows that wound healing is to do with granulation tissue. On what day does it begin and what day does it become maximum? Dono batao. In one comment tell me when does it begin, when does it become maximum. So on day 3 it begins and on day 5 it becomes maximum. Abhi everyone's asking 3-1. Wo you are telling me about the collagen type. That is coming on its way, but abhi tell me days. On what day does it begin? Day 3. When does it become maximum? Day 5. This is about granulation tissue. If I ask you the same question from collagen point of view, collagen is gonna begin on which day and maximum on which day? So remember, everything begins on the same day. Day 3 is the most important day of wound healing. Everything begins on day 3. That is, granulation tissue also begins on day 3. The collagen also begins on day 3. Only the days that are going to be different is maximum. Granulation tissue becomes maximum on day 5. And when does collagen become maximum? Day 21 or week 3. Whatever suits you, whatever you have learnt in your notes. Same hi cheez hai. Day 21 or week 3. So simple. The starting day is the same. That is what I wanted to tell you. Everything starts on day 3, but granulation maximum on 5 and collagen maximum on 21. Now your favorite question, which everyone was answering earlier. What is the difference in the collagen formed in the beginning and the collagen in the end? So if you see the collagen in the beginning, what type is it? And what is the type that it converts in the end? So if you remember, this was your NEET PG question. Starting में the collagen is of what type? It is of type 3, and in the end you have collagen type 1. So यहाँ पर भी देखो, starting में it is everything is coming out to be 3. Days are also starting day, day 3, collagen type also starting में collagen type is 3, and in the end it transforms into collagen 1. Everyone's okay with this question? Now let's come to the most, what do I say, ghisa pitha question of NEET PG, and that is this. 100% wound strength is obtained by when? You've seen this 1 trillion times in your PYQs. 100% wound strength is obtained by never. None or never. So that is never ever gonna happen. Never ever. Hai na? So this is the most, I mean, even in your sleep you can answer this. And yeah, students are seeing all this in the sleep. One student today morning asked me that, ma'am, I dreamt that you posted one PDF and then you deleted it. And I was also wondering that I did not post anything. So basically a lot of students have started dreaming, and that's totally normal and natural to happen in the last days. So if that, all that is happening to you, either you're dreaming or you're having sleepless nights, but trust me, all of us are in the same boat, so chal jayega. Just last 4 days you have to survive through this. Okay, so this is done. Now let's go on to the next one. Very important, you know, imprinting deletion. Matlab there are 2 diseases. One is Prader-Willi, one is Angelman. What is deleted, what is imprinted? Maternal, paternal ka story always troubles me. So tell me, Prader-Willi mein what is imprinted and what is deleted? For that you all have to remember, that is Prader-Willi. तो Prader-Willi मतलब Papa's region deleted. That is where the entire slide only ends. मतलब एक word में everything, you've hit a 6 out of the stadium by this. Okay, what is Prader-Willi? Papa's region deleted. Excellent. So if they ask you what is deleted, paternal is deleted. So automatically ulta, what is imprinted? Maternal is imprinted. That is Prader-Willi. And iska opposite kar do. What is Angelman? In Prader-Willi, Papa was deleted. So in Angelman, maternal will be deleted and paternal will be imprinted. How simple is that? So all, like I said now, with one shot you have won the game. Prader-Willi, Papa region deleted. Bas utna yaad hai, then the rest of the story is done. Quickly tell me, which out of these is the chota mota bacha? What is chota mota bacha? Means chota means short heighted and mota means obese. Chota mota bacha is who? The Prader-Willi is a short stature. Prader-Willi is a short stature and an obese kid. That is Prader-Willi. And Angelman will be given to you as happy puppets. They will be said to be kids who are forever laughing. So happy puppet is gonna be Angelman. Simple. ये वाला भी slide हो गया. जल्दी से revise. Shall we move on forward? You know what are you going to revise next. You know the order that is happening. Next is going to be quickly revise all these trinucleotide repeats. Their sequences, again a full on ratta thing that you have to be very, very, you know, crystal clear with. Fragile X syndrome mein what repeats happen? Fragile X syndrome mein it is going to be the CGG repeats. I am saying Fragile X syndrome. How many repeats are there? More than what is the criteria? More than 200 repeats hoga, only then will I talk about Fragile X syndrome. Anything less than 200 is not Fragile X syndrome. Very good. So CGG, and now I've got one student who's written all in one go. Okay, ma'am, this is on my fingertips. Very good. Fragile X syndrome is CGG. When we say myotonic dystrophy, beech mein TT is coming. So myotonic dystrophy is CTG. We had done this in our rapid review also, if you remember. Myotonic dystrophy is going to be CTG. Perfect. Friedreich's ataxia. So many A's. And remember I told you friend Gana ga raha hai, friend is singing, so GAA, friend Gana ga raha hai, that is GAA, super good. And Huntington disease, what is Huntington ka mnemonic? Ye to sabko aise in your, like I said na, some things are coming organically in your sleep also you can answer. Hunting in a cage matlab there is gonna be CAG repeats, and why E? Because this is the only one that is happening in the exon region, means all the others were related in the intron region. Very, very good. One last time in your life you are learning this, because after this you're not gonna have time, and I know after this you'll never come back to this, because all of you will get your dream branch and never will you have to learn all this hunting in a cage and all of that. So this, for the one last time in our life, we have finished this off. Very, very good. If I say out of all of these, which is the one in which the person is going to have hatchet faces? Hatchet faces किस में होगा? Everyone knows. Myotonic dystrophy. Remember I showed you a picture, hatchet faces, Christmas tree, cataract. Yes, that is okay with everyone. Perfect. Dr. Shamli has a question. Huntington's is XLR. No, Huntington's is, remember we did a mnemonic, he has a very dominant and powerful father. Huntington's is autosomal dominant. It is an AD. It is autosomal dominant. For that matter, Huntington's is also autosomal dominant, and myotonic dystrophy is also autosomal dominant. ठीक है? चलो हो गया. Coming to the next question. This is a question that came in INI, it came in FMG, we are expecting it. तो कुछ तो something on PCR examiner is gonna ask me. ठीक है, something the examiner is gonna ask me. So, what are the steps of PCR? पहले तो I will tell you the steps of PCR because that came in the last INI-CET. तो जल्दी से you're gonna tell me what is DAE. The first step of PCR is gonna be denaturation. Very good. The next step is going to be annealing, and the next and the last step shall be extension. Imagine an exam of INI-CET level give you such a basic question which you study in your 11th grade in school. What are the steps of PCR? It is DAE. Denaturation, annealing, extension. ये question तो आ गया. अब थोड़ा सा extra they will try to ask me. So I will give you only 3 situations. You need to tell me which type of PCR will you use. If you want to detect BRAF V600E, if you want to detect this and BRAF V600E, I'll give you an example. Example, you're dealing with a case of hairy cell leukemia. BRAF mutation hota hai. What are you going to use? Which type of PCR? We will use single base primer extension. Very good. The name only tells me single base primer. Why did I say that? Because I know that I am targeting a single base. I am targeting exactly 600th location. So the same base is targeted. Very good. So a single base. And kuch bhi aisa likha ho. I'll give you one more example. Where do you see JAK2V617F mutation? This is a very famous one in polycythemia vera. So now you will say, here also ma'am I know कि अच्छा exactly 617 पे target करना है. When I know the exact area to target, that is going to be single base primer extension. Scenario number 2 guys, if there is a low tumor yield sample, you say ma'am I've only received 10% tumor cells, 12% tumor cells, it's a breast biopsy, I don't want to waste it. कौन सा वाला PCR करें? I will say please go in for pyrosequencing. Pyrosequencing is when you have a very low tumor yield. Coming to the last scenario, which I'm sure everyone knows. Quantitative assessment. I've just given you one example. You want to find out the quantity of something, number. Like I said, in which leukemia have I mentioned? कौन सा वाला leukemia for Philadelphia chromosome? Of course, we are dealing with CML. So you say, I want to find out how many Philadelphia copies are there. Patient earlier had 1000. After treatment, has it gone down to 500 or has it gone even beyond? I want to know the number. Very good, guys. We will do real-time PCR. Real-time PCR का दूसरा नाम is only quantitative PCR, but examiner will not write quantitative PCR, na? Examiner will write real-time PCR. So any kind of quantity related question is given, real-time PCR. mark kar dena. Simple. These are the 3 expected PCRs and I'm sure all of you have done this very, very well. So shall we move forward and go on to the next one? Can you tell me the answer to this? You know this technique is gonna come up in the paper. Very good. Acha, before that, Dr. Satvik, yes, you are correct. See, if they ask you, I'll just take a minute more. If they ask you what is the most important type of PCR which is important for low tumor yield, it is pyrosequencing. But if they ask you that which is the best technique overall, even better than pyrosequencing, is next generation sequencing. So now listen to the options carefully. So agar NGS, next generation sequencing, is there in the options na, to mark NGS. If not, then mark pyrosequencing. That's a Robbins 10th edition update. So yes, Dr. Satvik, you're totally right on that. Meanwhile, everyone has already started answering the questions for karyotyping. Kaun sa phase? Simple. Ye to simple baby question. The phase is gonna be the meta phase. Very, very good. And fixative. Meta phase arrest. So don't think this is a very baby question. It will not come. Sometimes you never know how such a chota sa basic concept is put up in the paper. So meta phase is okay. And what is the fixative that we'll use? We will use the Carnoy fixative. We will use the Carnoy fixative. Carnoy fixative ka you know na, they will give you the percentage, how much of methanol and how much of glacial acetic acid are you using. So very simple, I've written the 2 alphabets like that, C and A. C matlab third alphabet, A means first alphabet. So 3:1, methanol and glacial acetic acid is 3:1. Okay? Everyone's learned this. Now tell me, most common banding. Much expected. In fact, this picture given over here is the most common banding. Perfect. It is G banding. G ka full form GIMSA. G banding, G ka full form GIMSA banding, right? But if they twist the question and they say what would you use on a fluorescent microscope, to ye wala photo dekho, fluorescent, green shining fluorescence. To Queen needs a fancy microscope. Remember that? Queen needs something fancy. So quinacrine banding. Quinacrine banding or Q banding. Perfect. Queen hoga, so you will obviously need a fancy wala microscope. How nice. How nice is that? I mean, when nothing is, I feel the porosity of your brain has become zero. Matlab, there are no pores only. The information is like stuck and embedded and is not ready to get out only, which is so good, and I feel so nice listening to all these answers. Trust me, I don't know how much of confidence you are getting in yourself. At least I am super duper confident that with all these answers that I'm seeing, that I have no doubt about what a big dhamaka you guys are going to do in NEET PG. Trust me, have that confidence in yourself, just in case you were not having that till now. Okay, let's move on to the next one, guys. We are going to have a long 2 slides, but that will wrap up all of your mutations. तो जल्दी से कर लेते हैं, might as well, ठीक है? तो RET, what is RET का, जल्दी, what is RET वाला? Thyroid cancer, direct question I've asked you. Thyroid cancer, तो बहुत simple था. We had to put up RET 10 med men. RET 10 med men. बहुत simple. RET is what? RET is the name of the gene. 10 is the name of the chromosome. Med is medullary carcinoma thyroid, and men is men 2A, men 2B. Men 2A, men 2B. Medullary carcinoma thyroid. Bola hi hai, to tell me the tumor marker na. When you've mentioned it, what is the tumor marker of medullary carcinoma thyroid? The most important tumor marker is calcitonin. Super good, very good, guys. You've done this. So बहुत अच्छा. This was also one of the things I posted today morning on Instagram for you guys. So RET 10 med men. Pediatrics में बताओ. Pediatrics में if I say that the RET gene is lost, loss of function, which disease in pediatrics is it? RET gene. I always told you, if RET will be lost, something else will be lost. Ganglion cells will be lost. What is that disease of pediatrics? That is the Hirschsprung's disease. Very good. So agar RET chala gaya, if RET is lost, it is going to result in Hirschsprung's disease. Very important megacolon wala jo disease hai in pediatrics. Coming to the next, C-kit. C-kit wala mnemonic, so I don't think anyone's ever gonna forget. C-kit is like games, and whenever you go to play a game, you always carry a kit. That is how we had learnt it. Ab games mein kya karte ho? Games mein you keep running to and fro, hai na? Matlab games is all about running from one place to another. So games mnemonic also, you will keep running from one place to another. I'll tell you how. So G is gonna be for gist. Then A, which leukemia? ALL or AML? So you will say, ma'am, let's run forward. AML hoga. Then let's run backward. MA kuch hoga. MA is going to be mastocytosis. Then again let's run forward. Running forward matlab ME, melanoma, and then again let's run backward. SE matlab seminoma. So like I said, games mein bas all that you're going to do is run here and there. So just AML, melanoma, mastocytosis, seminoma. These are all the things that show you c-KIT mutation, and you can't forget the CD markers. Na? I know all of you are waiting that when will ma'am torture us with CD markers, very soon. But abhi ke liye what is c-KIT? C-KIT is going to be CD117. Super good. Last one. Where do you see BRAF mutation? BRAF is all of you right now, multitaskers. BRAF is going to take care of 6 tumors of my body, and all of you have to be BRAF. All of you have to be BRAF abhi. With one hand you are doing PYQs, abhi high yielding rapid reviews. You have 1 million places to go ahead with crash courses, and I feel so bad for all of you. But yeah, you are BRAF right now. So what is that? So BRAF is going to be LCH, Langerhans cell histiocytosis, and ulta padha, that is going to be hairy cell leukemia. Then we have PNP. Thyroid wala kaun sa? Most common mutation in papillary carcinoma thyroid. Most common mutation, BRAF mutation. And what is the tumor that you have in the brain? Juvenile pilocytic astrocytoma. Other than that, you have colon cancer and melanoma. Very good. So LCH, HCL, PCT, JPA, melanoma, colon cancer. All these 6, all of you are BRAF for the next 4 days, right? Chalo, moving on to the next. We are going to have a quick revision of the next slide, which is the tumor markers. Jaldi, one tumor marker you're going to tell me. You know this is a sure shot question. Aega hi aega. Alpha fetoprotein. All of you are going to tell me 3 tumors. No missing out on any one also. Alpha fetoprotein is going to be what? It is going to be yolk sac tumor, perfect. And 2 tumors which you're going to tell me from the liver. One is hepatocellular carcinoma and one is going to be hepatoblastoma. So these 2, yolk sac tumor, HCC and hepatoblastoma, very good. When I say the next one, this question came in the last year exam, CEA, there is a long list. I don't want you to tell me the long list. Tell me the one most important tumor for carcinoembryonic antigen, and that has to be colon cancer. This is a sure shot question that you're gonna get. Super good, very good. Coming on to the next one. Yes, CA markers to you know, all time expected hai. CA 125. Can you tell me CA 125? Don't mention ovarian tumors, that I am writing. You will tell me which ovarian tumor shows you CA 125, which category. Sex cord stromal or germ cell or surface epithelial, that is your work to do, which you have done of course very well. Surface epithelial tumors are gonna be CA 125 positive. Very good. CA 19-9. Again, ma'am, ये तो हमें mnemonic in our sleep also. 9 का उल्टा P. So that is pancreatic cancer. Very good again. And CA 15-3. So from 3 you will make a B. So what is that? That is going to be breast cancer. Bas, these are the most important tumor markers that you have to know. Then some tumor markers which I have not written over here, jo sabko pata hi hai. If I ask you beta HCG, no point revising that. That is like embedded in our memory forever, right? Beta HCG matlab choriocarcinoma, there's no doubt about it. If I ask you calcitonin, which we just discussed, calcitonin was medullary carcinoma thyroid. So these are such basic ones that iska revision is not needed. Ye to sabko pata hai. But the ones that you had to revise, that I've put up in front of you. So this is also done. Now the next slide. Please don't run off on this slide, because you know that we all hate it. You and I, all of us hate it. And there are just 2 slides that I want to quickly tell you about the CD markers. You like it or you hate it, you can't ignore it. Wo wala haal hai, right? You will have to do that. So what are the CD markers for the NK cells, natural killer cells? Yes, so what is it going to be? So you have 16 and 56. 16 and 56. So 16 is obviously the ideal, the ideal measurement of any bodybuilder going in for making his biceps. So 16 inches ka biceps, and we all know the famous memes that came around with the 56-inch chest, right? So 16-inch ka bicep and 56-inch chest, that is going to be natural killer cells. But the last exam had some new marker. Kaun sa wala new marker tha? CD94. Yes, this came in INI-CET. You never know when would it be repeated. 16, 56 and 94. Okay, T cells. Can you tell me for T cells? तो बहुत simple है. Start from 1. See, look at how I am saying this. 1 to 8, 28. Very simple. 1 to 8, 28. Khatam. That is T cell. So out of this, if I ask you, which is the pan T cell marker? Pan T cell marker is going to be CD3. And which CD marker is signal transducing. Signal कौन लेके जाएगा? That is also going to be CD3. मतलब CD3 is the entire hero of this story. Pan T is also CD3. Signal वाला is also CD3. तो सब कुछ CD3 चलेगा, है ना? Simple. Now, when I ask you for the B cells का story कैसा होता है? B cells का story is you go in like doubles, 10s, then double 20s, then double 40s. Means 10 matlab I have written 10, double matlab 20. So you start from 19, 20, 21, 22, 23. So here you go. 20s ka double 40. So here you go to CD 40. 40 ka double 80 na. 80 I'm not gonna put up. 79A and 79B मतलब 80 के very close. We've just gone बढ़ाते जाओ. B cell double. 10s, then 20s, then 40s and almost near to 80 is what you have for B cell. The twist in the story, please listen to me. What is the pan B cell marker? Pan B cell marker is CD19, okay, but who carries the signal over here? देखो T cell में तो everything was CD3. Pan T was also CD3, signal wala was also CD3, but here it's different. See, what did I write? Just listen to me for a minute. 19 is the pan B cell marker, है ना? 19 is the pan B cell marker, but who carries the signal? If I have to carry the signal like this and like this, what number does it become? Who is going to carry the signal? कौन सा number बन गया? 79A and 79B are gonna carry the signal. How easy is that? So repeating once again, if they ask you what is the pan B cell marker, you will say 19, but who will carry the signal? The signal is gonna be carried by 79. Easy हो गया, right? So अभी तक the story is simple. Now tell me the question that came in the FMGE exam. How does Epstein-Barr virus enter into our body? Via which receptor? Epstein-Barr virus enters via CD. Come on, this to matlab some questions are like baby questions. I don't know why am I asking it. You guys will be like, ma'am, itna to हमें आता है. How does Epstein-Barr virus enter? CD21. सबको याद है. Very good. So 3 things are done. Quick revision. NK cell is 16, 56 and 94. T cells के लिए rhyme की तरह 1 to 8, 28, 1 to 8, 28. B cells के लिए double, 10s, 20s, 40s and almost near 80. Now, the next part is, I also have a smile on my face because I know you guys are going to hate me for this table. But as I said, you have to do it. Myeloid, monocytoid and megakaryocytic lineage. How am I going to learn this? Let's try and make it a little simple. Myeloid lineage, 1333. Myeloid को तो ऐसे ही रट लो 1333. 13 and 33 are gonna be the myeloid and of course myeloperoxidase तो anyway याद आ जाएगा because myelo word will only tell me, है ना? तो myeloperoxidase तो understood but CD marker में 1333 यहाँ तक हो गया. Okay, monocytoid, this I am not gonna answer. I'll take 5 seconds and I want all of you to answer कि monocytoid कहाँ होता है. तो monocytoid is gonna be, yes, so most students have a problem in this. So look at this. Monocytoid is, never mind, abhi you all hate this. तो नहीं, वो 41, 42 that you're mentioning ना, वो megakaryocytic है. Suddenly everyone's gone into like this, you know, full sannata has happened over here. कि oh my god, let's not learn this only. देखो mono you will learn as forever single. Mono ना, mono मतलब single, forever single मतलब, now mono is 1 single 1 single तो 1 मतलब single. 14th February को भी single, 14th February को भी single and single till he dies. So 64 की age पे भी single. Mono is like forever single and I don't wish that for anyone ever. So what is mono? Single 1 मतलब single, 14th February को भी single and single till he dies, so that is going to be 64. हो गया याद? So I hope this mnemonic comes back to your mind. Coming to the next, megakaryocyte. Megakaryocyte is going to be, mega matlab something big. How many of you used to play PUBG? If you were fond of PUBG, then you must be knowing कि megakaryocyte, mega matlab something big na, something dangerous is gonna come up. So that dangerous was, if you remember, M416 एक gun होता था. PUBG में there was a gun called 416. You guys have played with it. I used to once upon a time, but now no one plays. हाँ, but 416 gun था. So basically for megakaryocyte, 41 मतलब CD 41. 41 का brother 42 and उल्टा क्या बना 61. So that is gonna be 61. So you learn mega as the mega gun of PUBG. ठीक है. So now is this table a little easy? कुछ तो easy हुआ ना? In the beginning all of you sent me those sad emoticons. Now it's gonna be easy, right? So coming back, myeloid में तो सीधा याद करा 1333 खत्म. Mono is तो very painful story. Forever single, 14th Feb को भी single, single till he dies, तो 64 पे भी single. Megakaryocyte is 4161, so 4161 वाला gun that you have in PUBG, that is gonna be there. ठीक है, now this becomes one of your favorite most, from the worst to the favorite most slides it has become. हो गया. Now the next slide. Now finally you can take a sigh of relief because this is becoming a little simpler. The next slide that we come to, not so simple. Okay, so what is that? That is antibodies. All of you had requested me to make a list of these autoimmune disorders का antibodies, तो जल्दी से let's make that. Start answering. So in case you're tired of typing, अभी tired नहीं होना, we have a long way to go. So what is it for SLE? SLE का most sensitive. Honestly, if you honestly ask me, ma'am, did you come and sit and count 100 one-liners? मैंने कोई count नहीं करा. Whatever was coming to my mind as gut feeling, I have written it over here. I have not counted. So these obviously are going to be more than 100, but will genuinely help you. Okay, so what is it going to be? Most sensitive, very good. Most sensitive is anti-nuclear antibody, very good. Most specific, come on, give me time to write, guys. This is like flooding the chat box. You're like, ये सब आता है, सब कुछ आता है. What is the most specific? Great, anti-Smith, good. Sensitive is anti-nuclear, specific is gonna be anti-Smith. What is both sensitive and specific? दोनों benefit, दोनों benefit मतलब double-stranded. Double-stranded anti-dsDNA. So that is how we had learnt it. दोनों benefits है तो double-stranded DNA. Neonate is always gonna cry. Neonate will cry. So anti-Rho antibody. Neonate is always gonna cry. Rona dhona. So that is anti-Rho antibody. Lupus with psychosis. तो psychosis is with P ना, तो कुछ P वाला होगा, that is ribosomal P. This is a question that you get in medicine a lot. Anti-ribosomal P वाला, तो P for psychosis is what it is going to cause. तो simple हो गया, यहाँ तक तो I have learnt. Ribosomal P for psychosis, रोना धोना, रोना मतलब neonatal, double benefit, तो double stranded यहाँ तक हो गया. Now let's go on to the next one. This is to my favorite. Sjogren syndrome. S for Sjogren, S for syndrome. What are the antibodies going to be? This to examiner will be like a very good mood में when he'll give you this question. Anti-SSA and anti-SSB. So SS for Sjogren, SSA, SSB, but examiner is never in a good mood. Examiner कहीं तो twist करेगा. Anti-SSA is gonna be Rho and anti-SSB is going to be La. So the question given to you will be anti-Rho antibody, anti-La antibody. ठीक है? Anti-Rho and La is nothing but SSA, SSB. SS मतलब Sjogren, which is sensitive, which is specific. तो Rona is sensitive, considered to be sensitive. अभी that is all what all of us are doing. Last 4 days, all that we are going to do in life is रोना धोना के कुछ याद नहीं, fail हो जाएंगे, all that रोना धोना which every medical student does. तो बस वही रोना धोना is a sign of being sensitive. That is the most sensitive and La becomes the most specific. Coming to the last two, scleroderma, limited scleroderma, diffuse scleroderma. Remember, limited scleroderma is going to be anti-centromeric antibody. Very good. Anti-centromeric antibody. And I think this has been the most relatable thing that I said. Suddenly everyone was like, ha ma'am, too much rona dhona happening. I can imagine all of us have gone through that. I have also done that rona dhona when I give NEET exam, prof exam, practical exams, MD exam. Rona dhona never ends for a medico. So get used to it. 4-5 days you will cry, exam ho jayega, you will be happy after that. It will become a routine in your life. ठीक है? तो limited के लिए क्या है? It is anti-centromeric antibody. Diffuse के लिए क्या है? There is anti-topoisomerase antibody. How am I going to learn this? That is, when we have limited, something is limited to a place matlab centered to a place. Centered to a place means centromeric. When I say diffuse means all over the body. All over the body is going to be what? Total matlab topoisomerase. Simple, everyone sorted. Let's move on to the next question. So now this one slide is done. All the antibodies of these autoimmune disorders done for us. Okay, Dr. Ashraf stays still crying watching this video. No, don't cry. Abhi this video ka purpose was to get rid of all the tension. So don't cry. If you're having tears of joy, that is good, but don't cry for tension. ठीक है? चलो, stress buster होना चाहिए. It should not add stress to your life. So 2 slides that now you're going to tell me with regard to all the vasculitis So tell me, which is the most common vasculitis in adults? The most common vasculitis in adults is given right in front of you, is giant cell arteritis. Giant cell arteritis matlab you know the other name, you know the picture that is in front of you, ye temporal wala. So question unlocked. So now giant cell arteritis ka question unlock ho chuka hai. Tell me everything about GCA because this is much expected. Okay, so what is the most common artery? The most common artery is going to be the temporal artery. The most common artery, tabhi there's a picture over here of temporal artery. Headache. Obviously the most common symptom will become headache and not some diffuse headache. This is a localized throbbing headache. That is how the patient is going to present to you, localized throbbing headache because temporal artery. But ये सबसे common है. If they ask you what is the most specific symptom, specific is over here, the jaw pain, very good. The specific is going to be the jaw pain over here, super duper good. And which is the most dangerous? Dangerous wala is, of course, dangerous if someone's vision goes. So loss of vision is going to be dangerous. So ab isme kya karna hai? You know all the answers. It's all about reading the question carefully. Examiner ne common wala pucha, that is going to be headache. Specific pucha, that is going to be jaw pain. And dangerous pucha, that is a loss of vision. So loss of vision ka chance hai, matlab I cannot take any risk. What do you do with these patients? Treatment with steroids, stat. Do not wait for even a minute or even a day because if he loses his vision, then of course that's very grave. So you have to start with steroids ASAP. ठीक है. Coming to the next, what is the vasculitis with a weak upper limb pulse? ये तो easy है. Pulseless disease वाला कौन सा था? Super good. Pulseless disease wala is going to be Takayasu arteritis. Takayasu ka naam hi is going to be the pulseless disease. So this is unlocked. Takayasu arteritis ka vessel batao. What is the most common vessel then? The most common vessel is going to be of course arch of aorta. But arch of aorta may be which vessel is going to be most commonly affected? It is the subclavian artery which is most commonly affected. Most common सबक्लेवियन. वेरी गुड. तो सिंपल है, देखो दे विल आस्क यू जायंट सेल, तो जायंट में होगा. जायंट सेल कहाँ होता है? अबव 50. जायंट्स में होता है अबव 50 ईयर्स ऑफ एज. एंड टाकायासु दे विल गिव यू लेस देन 50 ईयर्स ऑफ एज में. दैट्स अ वेरी सिंपल थिंग टू लर्न. जायंट सेल जायंट में होगा, टाकायासु जायंट में नहीं होगा. इट्स गोइंग टू बी लेस देन 50. कमिंग टू द नेक्स्ट, लेट्स सी इफ यू कैन अनलॉक द नेक्स्ट. फर्स्ट वाला क्वेश्चन तो यू गाइज हैव एनीवे अनलॉक्ड इन द फर्स्ट स्लाइड ऑफ दिस discussion session. Vasculitis that will occur in an HBsAg positive person. I remember all of you gave me the answer right in the beginning. Polyarteritis nodosa. Now this is unlocked, so you will tell me polyarteritis nodosa does not involve. One last time in your life learn this. Polyarteritis nodosa किसमें नहीं होगा? Which vasculature does it not involve? It is the pulmonary circulation. Very good. The pulmonary circulation is not gonna be affected. Very good. Last time, because अब इसके बाद तो I don't think you have more capacity to do pan again and again. काफ़ी बार कर लिया. So HBsAg positive person, it is going to not involve pulmonary circulation and 3 alphabets था. So the examiner is going to give me a necrosis known as the fibrinoid necrosis. वेरी गुड. नेक्स्ट वाला अगेन दिस तो इज सुपर सिंपल, ये तो कोई भी बता देगा. व्हाट इज द वैस्कुलाइटिस इन अ किड विद स्ट्रॉबेरी टंग वाला फोटो? ऑफ कोर्स दैट इज गोना बी कावासाकी. ये तो बेबी क्वेश्चन, तो टफ क्वेश्चन क्या आएगा? कावासाकी डिजीज का एंटीबॉडीज, व्हाट इज वी आर एक्सपेक्टिंग इन दिस पेपर? व्हाट इज द एंटीबॉडी लीडिंग टू कावासाकी? प्लीज नोट दिस इन केस यू हैव फॉरगॉटन. एंटी एंडोथेलियल सेल एंटीबॉडीज. एंटी एंडोथेलियल सेल एंटीबॉडीज, दिस इज वन ऑफ द अपडेट्स एंड दैट इज व्हाई आई वांट यू टू नो. ठीक है, एंटी एंडोथेलियल. समवन सेड IgA. नहीं, IgA इज इन हिनॉक्स शॉनलेन पर्प्यूरा. यू हैव टोल्ड मी एन आंसर फॉर वन ऑफ द फ्यूचर स्लाइड्स, बट अभी के लिए कावासाकी डिजीज इज एंटी एंडोथेलियल सेल एंटीबॉडीज. ठीक है. व्हाट इज द वैस्कुलाइटिस इन स्मोकर्स? दिस वाज वन ऑफ द FMGE एग्जाम क्वेश्चंस ऑन Jan 20th लास्ट टू लास्ट मंथ. सो व्हाट इज इट? Smoker, BD burgers. So what disease do we have? Which vasculitis occurs in BD smokers or just in smokers? It is going to be the Burgers disease. Very simple. So what came in the exam was कि they give you some smoker, BD or some cigarette smoker. Burgers also you identified. उसका second name was asked. What is the other name for Burgers which you all know? It is known as thromboangiitis obliterans. Very good. So Burgers is known as thromboangiitis obliterans and that was the question that they asked you in the FMGE exam. हो गया ये वाला slide. Can we move forward? You know that there is obviously going to be a question related to the ANCA, मतलब ANCA के बिना तो I cannot end this session of vasculitis ना, I have to know. What are the two ANCAs? C ANCA, P ANCA. पहले तो figure out the confusion, sort out करो, what are the other names? So what is the other name for C ANCA? Very good, C ANCA is known as CPR. What will save you? CPR will save you, मतलब C ANCA is also known as PR3 ANCA. Very good, PR3 ANCA. So obviously what is the other name of P ANCA? P ANCA is known as MPO ANCA. तो पहले तो I had to give you names. Names सबको पता है CPR, तो C is proteinase, PR3 ANCA. What are the diseases? So remember that some people, there are many mnemonics. Some people learn it as Vipro, because today we are talking all about cricket, so it is going to be World Cup. So C ANCA किस में होता है? C ANCA is going to be seen in Wegener's granulomatosis. C ANCA is going to be seen in Wegener's granulomatosis. And after that, where do you see P ANCA? You will say, ma'am, P ANCA to pan spectrum. Baki sab kuch, everything that you can think of. So if you ask me microscopic polyangiitis, I will say P ANCA. If you ask me Churg-Strauss syndrome, P ANCA. Tell me one intestinal disease. Real question to ab shuru hua. Which intestinal disease shows you P ANCA? Ulcerative colitis. Very good. And Dr. Satvik and Dr. ZZZ, don't sleep off. ZZZ have also said which liver disease? Primary sclerosing cholangitis, PSC. Yes, very good. So remember C ANCA के लिए तो वर्ल्ड कप या विप्रो याद रख लो, that Wegener's shows you C ANCA और PR3 ANCA. बाकी everything else mentioned will be pan spectrum, microscopic polyangiitis, Churg-Strauss, ulcerative colitis, PSC. Everything is going to show me. अच्छा, one question very randomly. PSC में what is the appearance that you see microscopically? Primary sclerosing cholangitis. What is this appearance? As soon as I draw it, I don't have to write it. Primary sclerosing cholangitis is going to show you the onion skinning. Onion skin fibrosis is seen in primary sclerosing cholangitis. Very good. And beaded appearance and all that you're telling me the radiology probably. So radiology mein you're right, it shows you beaded appearance, it shows you pruning also, pruning of the small bile ducts, and it shows you beading appearance, bilkul theek. And when you're talking about microscopy, it is onion skinning. Bahut achhe, very good. Now you're going to do the next one. It's a riddle type of a one-liner. It's not a one-liner, but it's a riddle. Guess the condition. There's a person who's come to you with purpuric rash, arthralgia, abdominal pain, and renal involvement. What is that? So purpuric rash, arthralgia, abdominal pain, and renal involvement. As soon as this Parpura question comes in front of me, yes, amazing. This is a case of Hinoch, Schonlen, Parpura, jaisa bhi bolna hai. What is this Parpura question? So P for purpuric rash, A for arthralgia, A for abdominal pain, and R for renal involvement. Renal involvement matlab there is going to be hematuria. Someone said chota bachcha. Exactly. This is going to occur in children, but my question is कि child में Parpura होगा, very good, but which antibody is associated? Someone had answered, ये पहले होगी, मतलब अभी 10 minutes ago only someone had answered. Which antibody causes Hinoch, Schonlen, Purpura? IgA antibody. Very good, excellent. तो ये तो हो गया. And someone says, ma'am, this में thrombocytopenia नहीं होगा. Very good. I mean, the amount of overflow of knowledge that I'm seeing in this session, I have never ever seen before. So it gives me so much of happiness. You can't even imagine. So yeah, this is a case of Hinoch, Schonlen, Parpura, and it is associated with IgA. Very good. Coming to the next. Now I'm going to give you 2-3 riddles. जल्दी से you solve the riddle, because one-liners ऐसा कभी boring हो जाता है ना, तो जल्दी से solve the riddle. The first riddle is in front of you. You have to guess the series of cardiomyopathy. So let's see if you can guess this cardiomyopathy. A person who comes with emotional stress, severe emotional stress, matlab broken heart. No, that broken heart is no stress. The day this person will give NEET PG exam, he will get to know कि real stress क्या होता है. Real emotional stress is not any heartbreak. Real emotional stress is NEET PG exam. So yes, what is this? The broken heart. Exactly. This is known as the Charcot-Marie cardiomyopathy. Exactly. But the only question that you'll expect is, कौन सा वाला ventricle is gonna become like this pot? So which ventricle is dilated? This is only and only left ventricle dilation involvement, not all the ventricles getting dilated. If all the ventricles would have got dilated, तो कौन सा होता? It would have been DCM. If all the ventricles would have got dilated, तो it would have been DCM. But यहाँ पे only left ventricle. तो DCM का भी, now that you've told me, if you've already unlocked that question, तो DCM में क्या क्या question आएंगे? DCM में सबसे पहले dilated cardiomyopathy means all the 4 chambers are dilated. all 4 chambers are going to get dilated. Either they will give me कोई chronic alcoholic वाला patient, ठीक है. Next, they will give me some mutation. So, titin gene mutation इनका काफ़ी favorite है. Titin gene mutation and alcoholism वाला patient favorite. And what is this classical nucleus that you see? This मतलब obviously after consumption of alcohol, everyone thinks that they've become a ninja. So, alcohol consumption के बाद it is going to show you what? It is going to show you the ninja star nucleus. ठीक है, it is going to show you the ninja star nucleus. Very very important. तो देखो alcohol consumption, thinking he or she is a ninja, and what mutation? Titin gene, that is going to be dilated cardiomyopathy. All the 4 chambers get dilated. But if only left ventricle gets dilated, that is going to be Takotsubo. Very very good. Now the most again ghisa pita question. Which cardiomyopathy is going to be a sudden collapse or death in a young athlete? Come on, you see this 19-year-old basketball player. Okay, so meanwhile everyone started with Ninja Hattori also, that is good. Yeah, so that will be a separate conversation. Abhi so nice na, this session has abhi one-liners bhi chal raha hai, riddles bhi chal raha hai, side conversations are also happening, motivation is also happening, so many things happening in one session, never happened before. Okay, so what is this? This is sudden collapse or death. Very good. This is a case of hypertrophic cardiomyopathy. Tell me the mutation in hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy ko aage piche kar do. It becomes MHC, beta myosin heavy chain defect. It is a beta myosin heavy chain defect. So simple na, HCM, MHC. The heart is in front of you. It's a classical banana shaped heart, with all of you know, no need to write. But look at the fibers. The fibers are like totally gone. One is in left, right, vertical, horizontal, kuch bhi direction mein hai. That is known as the helter-skelter appearance. That is the helter-skelter appearance of the cardiac muscle fibers. Very very good. So this is what you obviously expect. It is very important. एक last चीज़ बता दो, what is this hypertrophy happening of? Hypertrophies of what? Left atria, left ventricle, right atria, right ventricle, interatrial septum, interventricular septum. ऐसा बहुत सारा options होगा to confuse me. Remember, it is only and only of the interventricular septum. It is the hypertrophy of the interventricular septum. Very 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 important point that you have to know. हो गया याद? Everyone's clear with this? Can I move forward to quickly making you answer something over here which you know? जल्दी जल्दी 2 ही तो कार्डियक ट्यूमर्स है, इतना तो कुछ है ही नहीं कार्डियक ट्यूमर्स में, है ना. वन आंसर जल्दी से टेल मी. विच इज़ द कार्डियक ट्यूमर विच इज़ गोना शो यू लेपिडिक सेल्स एंड विच वन शोज यू स्पाइडर सेल्स? टॉपिक ही खत्म. विच वन शोज यू लेपिडिक सेल्स? Very good. Lepidic cells are going to be seen in myxoma, right? तो myxoma का chamber. What is the chamber in which it occurs? So just make a rule that whenever a question on cardiac tumors will come ना, you will make the heart, वो baby वाला school time वाला box वाला heart you will make, and you will write Mr. like this, because Mr. will tell you myxoma ऊपर है, मतलब it is going to happen in the left atria. And what is नीचे? What is R? That is rhabdomyoma. Yes, rhabdomyoma shows you the presence of spider cells. Rhabdomyoma. And where does rhabdomyoma occur? You can see rhabdomyoma is occurring in the left ventricle. So as soon as you get this question, write Mr. Myxoma upar and rhabdomyoma niche. Further they will tell you myxoma is upar, so that is going to occur in big people, that is going to occur in adults. Rhabdomyoma is niche, chota sa bachcha. That is further what you have to know. So myxoma is going to occur in the adults and rhabdomyoma is going to occur in children. So that is how you will write it. Easy for everyone? Okay, someone said tuberous sclerosis. For which one? Myxoma ke liye, rhabdomyoma ke liye? Pata hi hai. That is for rhabdomyoma. Yes, it is associated with TSC. It is associated with tuberous sclerosis. Very very good. Super good. वेरी गुड. चलो ये भी हो गया. स्पाइडर सेल का फोटो तो आई डोंट थिंक आई नीड टू एक्सप्लेन, वो लग रहा है इट्स लुकिंग लाइक अ स्पाइडर वेब. बस टेल मी वन लास्ट क्वेश्चन, व्हाट आर दीज एम्प्टी स्पेस गोना बी पॉजिटिव फॉर? इट इज पॉजिटिव फॉर अ स्टेन दैट इज नोन एज पास पॉजिटिविटी. वेरी गुड. डॉक्टर केवी सेज ट्यूमर प्लॉप साइन. अगेन डोंट राइट दिस. मतलब किसके लिए ट्यूमर प्लॉप साइन? ट्यूमर प्लॉप साइन इज वेरी कॉमनली सीन विद मिक्सोमा, बिकॉज यहाँ पर होता है ना, इट अकर्स इन द लेफ्ट एट्रिया. सो व्हेन द heart contracts, basically this is the tumor, it tends to collide with the valve. So tumor plop sign आता है, that is going to be with myxoma. Very very good. Meanwhile spider cells के लिए pass also everyone's marked. तो हो गया, super good. Now what I'm going to take you to the next is, of course you know कि ये तो question आएगा, we cannot escape it. That is, what are the markers of lung tumors? Okay, what are the markers for lung tumors? Squamous, adeno, small and end में एक mesothelioma है, ठीक है. चलो, coming back. अच्छा, someone asked me which is more common. Of course, myxoma will always be the more common tumor. Any question about heart tumors and myxoma is going to be the common one, ठीक है. Question sorted. Let's move on. What are the markers of lung tumor? जल्दी, we don't have to make a lengthy session. हमें 6:30 तक wrap up करना है. तो अब last sprint, मतलब now you are closing towards your 100th century, तो जल्दी जल्दी करना है, ठीक है. चलो, coming back. Squamous cell carcinoma, very good. Anything to do with squamous cell carcinoma is gonna be keratin pearls. Pearls मतलब pearly markers आएंगे, PP वाले markers will come. You're gonna have P40, you're gonna have P63. This question came in the INI-CET recently only. P40 is the best marker. So yes, we have P40 best. So सब कुछ PPP for keratin pearls. Adenocarcinoma of the lung is gonna have everything with AA and 11. A is the first alphabet ना. Very good. So that is gonna be napsin A. एक तो A वाला napsin A and 1 वाला क्या है? Very good, muc1, TTF1. Wow guys, wow, for the first time this has happened कि my speed of writing is slower and your typing and your answer speed is like next level. So what is it? Napsin A, TTF1, muc1. Very good. Small cell carcinoma. Now this, remember छोटा packet बड़ा धमाका, you remember that story? Story sounds छोटा but the list is gonna be never ending. तो जल्दी से tell me that never ending list. First you'll write in. What is in? Synaptophysin. दूसरा chromogranin. This also came in the recent FMGE exam. Chromogranin. और एक और वाला in, that is going to be bombicin. Synaptophysin, chromogranin, bombicin. ये तो in था. तो 3 short forms भी हैं. What are the 3 short forms? NSC, CD56 and CD57. I know it's a lengthy list, but what was the advantage? If I'm making you learn so many things, so the advantage is that this will be a part of every neuroendocrine tumor of the body. Jaldi se, you have 30 seconds ka timer. I'm not giving these timers because I have any time shortage, but I don't want you to spend too much of time on one subject. So we have to be very quick. 30 seconds mein you will tell me what is the neuroendocrine tumor when it occurs in the thyroid, because everyone will have the same markers. So tell me, what is the neuroendocrine tumor in the thyroid? Thyroid में उसे बोलते हैं medullary carcinoma thyroid. Simple. What is the neuroendocrine tumor that occurs in the lungs? It's in front of you. It is going to be small cell carcinoma. One more neuroendocrine tumor lungs में भी होता है, GIT में भी होता है, appendix and bronchus दोनों में होता है. Remember carcinoid tumor? Carcinoid is also a neuroendocrine tumor. तो वहाँ पर भी same markers. Okay, so medullary carcinoma same markers, small cell carcinoma same markers, carcinoid tumor same markers. Then what is the neuroendocrine tumor of adrenal gland? ये तो पता ही है, वैसे ही पता है. न्यूरोएंडोक्रीन ट्यूमर ऑफ एड्रीनल ग्लैंड इज फियोक्रोमोसाइटोमा, मतलब सेम मार्कर्स. सो स्टोरी बिकम सो सिंपल ना, एवरीवेयर सेम मार्कर इन कॉपी पेस्ट कर देना, ठीक है. लास्ट वन, मीजोथीलियोमा, विच इज़ वेरी फेमस फॉर दैट राउंड एंड राउंड सामोमा बॉडी. मीजोथीलियोमा से 2 ही क्वेश्चंस हैं. वन इज द एक्सपोजर, विच केमिकल एक्सपोजर? I think we all know the chemical exposure is going to be asbestosis, and what is going to be the marker which many students tend to forget? It is calretinine positive. Calretinine positive. Someone said calcitonin. नहीं, calcitonin तो वो medullary carcinoma वाला था, and also because अभी तो ये छोटा confusion will happen ना, this calretinine, calcitonin. It's not that you don't know, you know it, but your mind has so much of information at this point of time ना कि वो calcitonin, calretinine होगा. But I can guarantee this will not happen in the exam, because in the exam you're not going to have 1 million things going on in your head. In the exam you will just have that one question in front of you, ठीक है. तो अभी छोटा मोटा overlap will happen, just don't pay too much of attention on it. Okay, chalo, let's move on to the next one. What do you have to tell me next? Where are we going? So here you go. Identify the disease in front of you. Some riddle things that we've got, है ना? Because one-liners में तो pathology हो नहीं पाएगा. What is the identification of this disease? The lung shows you hemoptysis. Patient also shows you hematuria. Lung is hemoptysis and patient shows you hematuria. मतलब जब दोनों जगह से bleeding in the sputum, bleeding in the urine. Yes, we are talking about Goodpasture syndrome, and I expect this also in the recent exam. Goodpasture syndrome में क्या पढ़ेंगे? Goodpasture syndrome was 1, 2, 3, 4 ना? What was Goodpasture syndrome? 1, 2, 3, 4. तो जल्दी tell me, RPGN कौन सा? It is RPGN type 1. Which hypersensitivity? Hypersensitivity type 2, तो RPGN type 1, hypersensitivity type 2, very good. 3 and 4 क्या है? Alpha 3 chain of type 4 collagen is affected. So alpha 3 chain of type 4 collagen. So simple, good pasture syndrome is a good mnemonic. Good pasture, good mnemonic है. 1, 2, 3, 4. 1 RPGN, 2 hypersensitivity, alpha 3 chain, type 4 collagen. Very good. Patient comes to you with bleeding from the lungs, bleeding in the urine. So lung and kidney involvement is gonna be noticed. Very important, and I am sure you all know it, है ना? Collagen 4 matlab which part of the body am I talking about? Remember 4 floor, basement membrane. So 4 matlab I am talking about basement membrane. Excellent. Agla question which is सबको पता है but I have to मतलब for completion I have to give you this. You know this is a case of Kimelstein-Wilson lesion and you know that immediately as I say Kimelstein-Wilson lesion I am talking about diabetes. So this is only for your revision कि जल्दी से एक बार देख लो. This was how Kimelstein-Wilson lesion was looking like. What was the other name of Kimelstein-Wilson lesion? Nodular glomerulosclerosis. कुछ nodule ऐसा छोटा छोटा ball लड्डू type something will be made. So you will see nodular. That is why you call it nodular glomerulosclerosis. ठीक है? Disease you have told me. I have already told you it is called as nodular glomerulosclerosis. बस stain बता दो. Which you guys have anyway told me. Ma'am, this is also pass positive. Honestly, pathology में when nothing is coming to your mind, तो pass positivity helps you in a lot of places. ठीक है? Very good. Everyone's given a right answer. Great. ठीक है, now when this is done, the next question is in front of you. So let's see, it's going to be a long journey, but I'm sure all of you will be able to answer this. You have to tell me ulcer. So now you will get ulcers in the paper, and how will you differentiate between all these ulcers is what you need to tell me. Identify the intestinal disorder. Yes, ileal infection with longitudinal ulcer versus transverse ulcer. So कैसे identify करेंगे? Very good. तो एक है TB, एक है typhoid. How am I going to identify? So first and foremost, when I say typhoid, tie, how do you wear a tie? Tie is worn ऐसा long में ना, तो longitudinal ulcer is gonna be seen in typhoid, and then the transverse ulcer. The transverse ulcer means ulcer in this direction. That is going to be seen in TB. So TB versus typhoid, no confusion. Typhoid is tie, so longitudinal. ठीक है. Now tell me, ये तो microbiology का most favorite question. Where are you gonna get flask-shaped ulcers? Of course, it is going to be Entamoeba histolytica. No points for guessing. The same Entamoeba histolytica happens in the liver, and you know there is one brown वाला pus that we will definitely get in the paper. कौन सा वाला है? Anchovy sauce appearance. वो कल के लिए छोड़ देते हैं. Let us leave something for micro also, otherwise we'll finish off everything today. But yeah, flask-shaped ulcer and anchovy sauce appearance for Entamoeba histolytica. Next, what is the ileal disease with serpiginous ulcers? What is that? This is something you need to know. Again, I don't have any basis, but gut feeling says ऐसा कुछ आएगा. So what is that gonna be? Serpiginous ulcer is very good. It is going to be Crohn's disease, not ulcerative colitis. Crohn's disease shows you the serpiginous ulcers. The serpiginous snake-like zigzag wala ulcers is going to be seen in Crohn's disease. I'll ask you, it's not always serpiginous. I'll quickly revise. Tell me guys, Crohn's disease was continuous or was it skipping? ये तो पता है, it is skip lesion. तो Crohn's disease में this was one ulcer, this was next ulcer, this was next ulcer, है ना? This is how it used to happen. But now those ulcers end up fusing. If they end up fusing, will it end up becoming a snake? तो ऐसा वो snake जैसा आ जाता है. Serpiginous ulcer, this is a PYQ. Most students tend to ignore this. Please note, this is very, very, very important that you're going to have. The last one is everyone's answered. Okay, what is the rectal disease that I see with superficial ulcers and pseudopolyps? As soon as I read the word pseudopolyp, I know for a fact that I'm dealing with ulcerative colitis. There's no doubt about that at all. ठीक है, everyone's okay with this information. तो ये ulcer in one place था. अब जब ulcer in one place कर लिया, तो quickly you're gonna tell me what is going to be this disease. Can you identify this particular tumor over here? Ulcers done. Now quickly 2-3 tumor things are gonna come up your way. Identify the brain tumor. As soon as I write CCC, as soon as I will write child, cerebellum, cystic, child, cerebellum cystic, radiologist लिखेगा there's a child with cerebellar lesion that is cystic, यहाँ पे दिख रहा है there is cystic. Of course you are dealing with juvenile pilocytic astrocytoma. As soon as they will say juvenile, you've understood, अच्छा juvenile मतलब it's a बच्चा, it's a छोटा बच्चा. Pilocytic, pilo word will remind you कुछ hair like, something pilo, pilo मतलब hair. So there are some hair like which fibers? जल्दी से okay, already got an answer. Come on, ये session हो ही क्यों रहा है? I don't think you guys are anywhere in need of this session because answers तो पता है. What is this gonna be? This is the rosenthal fibers, है ना? Rosenthal fibers, अच्छा वाला tumor, yes, this is a grade 1, very good, happy child, happy face, smiling face, ठीक हो जाएगा, child will be cured, nothing to worry, very very good. ठीक है, whereas now let me show you the next riddle. Identify this. Butterfly glioma with serpentine necrosis, you can see that a butterfly glioma with serpentine necrosis, this is going to be super bad. This is a bomb blast, yes, very good. Glioblastoma, do you remember? Do you remember I told you as soon as I use the word glioblastoma, medulloblastoma, pinealoblastoma, कुछ भी blastoma होगा मतलब brain में हो गया bomb blast. Brain में हो गया bomb blast मतलब grade 4 and I am very very sad, the prognosis is very very bad. So simple, any blastoma tumor in the brain and immediately make it very very bad. What is the question that you will get in glioblastoma? इनका favorite question. One is butterfly glioma, butterfly जैसा दिखता है left right दोनों तरफ, so that I have done. Serpentine मतलब like a snake, there is wavy necrosis हो गया. They will ask you the genetics. 90% of the cases are what? IDH wild type and 10% of the cases are IDH mutant type. That is the question. See, when it comes to brain tumors, na genetics पे question आएगा, we know it. So this is what you had to know. This is about glioblastoma. ठीक है, let's go on to the next one. Some things should be very easy and confidence boosters also na. So here we go. Our very favorite, the egg and the chicken story that we always used to study. That wherever there is an egg, there has to be a chicken. So where do you see fried egg appearance with chicken via blood vessel? ये fried egg, खाली egg वाला white fried egg appearance that you see over here, and these long lines like a chicken wire, that's the chicken wire blood vessel. Of course, you know, all of you by now, you also know how I'm going to write it. I'm going to write it with maximum andas possible in the story, है ना? Very good. That is oligodendroglioma. It has got all andas. इस पर भी दो ही question है. Photos तो you've seen. Genetics is what they'll get down to. So first tell me, what is the most common mutation that you have? The most common यहाँ पर भी IDH वाला mutation, but the question of co-deletion is their favorite. Co-deletion what? 1p19q co-deletion. So now either they will ask you a simple thing that 1p19q का deletion है, or they will say what is the impact of that? What is the impact of that? So 1p19q वाला deletion is gonna be having a good prognosis, means the patient will respond very very well to chemotherapy. ठीक है, ये याद आ गया ना? 1p19q अंडा tumor, you have to know oligodendroglioma. It's an all-time examiner's favorite. Super good. Coming to the last and another examiner's favorite. Identify the brain tumor when everything goes goal. So women love to do goal. बातों को ऐसा गोल घुमाना. That is what women like to do. So that is how students learn it. Why? This is not my mnemonic. Obviously, this is some boy only who made it. I remember once he typed it out in the chat box, and then I told him I'll be using his mnemonic. He was like, ma'am, women like to do सब कुछ ऐसा गोल बात घुमाना. तो women, because when we are talking about meningioma, meningioma is more common in women. That is why what is the hormone for meningioma? कुछ women related hormone होगा, progesterone receptor, and women को गोल घुमाना मतलब the tumor cells are also gonna be ऐसा गोल मतलब we see whirling of the tumor cells, and the calcium is also ऐसा गोल round, means you're gonna see samoma bodies. ठीक है, so now everyone, someone wrote girlfriend, someone wrote mother-in-law, मतलब सबका personal experiences are coming out. So let's keep that aside for a while, but yeah, let's learn it like that women are going to be गोल घुमाना. So remember, first and foremost, meningioma is more common in females. Females मतलब everything to do with females is going to come up in front of you. Pregnancy, of course females, तो pregnancy में ये tumor ज़्यादा होगा. Progesterone receptor से related this tumor is going to be more. Yes, you can see a tumor arising from the meninges, and you've told me the radiology sign, the dural tail sign, excellent. तो वो तो आता है, मतलब you guys are super knowledgeable, and सब कुछ गोल whirling of the tumor cells and the samoma bodies. Amazing. चलो, this one is also done. Now we move on to the next one. Just one CD marker ऐसे बीच में याद आ गया. I thought I should ask you because every time they ask you this question, CD99 or MIG2. CD99 or MIG2 is gonna be what? We are almost towards the end. देखो 6:30 का target था. I'll try my best that as a breathless I can extend it and I can finish it off. But हाँ 4-5 minutes ऊपर नीचे होगा. What is CD99 or MIG2? Very very good. So everyone said only Ewing sarcoma. Nothing else. You don't want to think of any other tumor. Nothing beyond Ewing sarcoma. Can you think of any ovarian tumor also that is CD99? Remember the story of the 99-year-old granny, granulosa cell tumor, the 99-year-old granny wala story. So remember CD99, only CD99 mentioned. If only CD99 is mentioned, you will think of that 99-year-old granny, that very old granny, that is gonna be granulosa cell tumor. But now if in the exam they say CD99 / MIG2, MIG2 is sounding like मिट्ठू है ना, मिट्ठू होता है बच्चों का नाम, बच्चों का pet name is usually मिट्ठू. So think of that bone tumor that occurs in the youngest kids, not kids but adolescents, occurs in the youngest wala people, that is Ewing sarcoma. Ewing sarcoma is usually gonna come as a bone tumor in adolescent, 17-year-old boy, 16-year-old boy. ठीक है, तो अगर CD99 को ऐसा pet name दे दिया, मिट्ठू वाला नाम दे दिया, तो think of a bone tumor that occurs in थोड़ा छोटा people. And if CD99 alone is written, then 99-year-old granny you will think of, and then you'll think of granulosa cell tumor. This is okay? Shall we move further? Acha, coming to the next. You know this was a recent exam question, although this is not a one-liner, but ab पूछना तो है ही. So what is this? These are the two needles that you have for, bone marrow aspirate. So which is the first one? Salha's needle or Klima needle? First wala kaun sa hai? So everyone saying first wala Klima. No guys, the first wala is gonna be the Salha's needle. The second wala is the Klima needle. How will I identify? Very simple. Whenever you get this question in the paper, just focus on the screw wala direction. If the screw is on the side, so side screw, S for S, side screw is Salha's, and if it is longitudinal screw like this, then it is going to be Klima. This was a recent exam question. You know, bone marrow aspirate slides are definitely expected. So repeating it once again, the Salha's needle is going to be side screw and the Klima needle is going to be longitudinal. Very good. Ho gaya. Let's move on to the next. Again, what is expected? Can you answer this? Neurological symptoms are associated with which deficiency? Neurological symptom, iron, B12, folic acid. कौन सा वाला deficiency? Iron, B12, folic acid. So they are expected with B12 deficiency, है ना? And कौन सा वाला neurological manifestation do we talk about? This is known as subacute combined degeneration. Subacute combined degeneration. And another thing that comes with B12 deficiency is this picture which you've seen. This is the most seen picture in every grand test, subject-wise test, or any other platform or GT that you give. ये वाला एक photo comes only, and that is going to be the pigmentation on the knuckles and the interphalangeal joints, and that is knuckle hyperpigmentation is also something that you'd see with B12 deficiency. Again, very very important, you know that. अच्छा, before that some of you were answering, which is very good. ये जो neurological symptoms होता है with B12 deficiency, what is the pathway in biochemistry because of which it happens? What is not converting into what because of which the neurological manifestations happen? I think everyone knows this. Excellent. There is something known as methyl malonyl coenzyme A is not converting to succinyl coenzyme A. Normally methyl malonyl coenzyme A converts to succinyl coenzyme A. That requires vitamin B12. A vitamin B12 is not there. This means this conversion will not happen. मतलब succinyl coenzyme A will not form, and succinyl coenzyme A नहीं बनेगा मतलब myelin will not form. Myelin will not form means that the patient is going to land up with neurological symptoms. So indirectly on this pathway, if I ask you what levels in the blood will increase, will this patient have more of methyl malonyl coenzyme A in the blood or succinyl coenzyme A? So yes, very simple. It is going to be an increase in coenzyme A, methyl malonyl coenzyme A, which you guys had anyway told me earlier also. So this is a question that I stole from your comments. Very good. ठीक है, same. Both of these things are going to go into B12 deficiency. Let's see another riddle time. Lots of one-liners that you quickly have to tell me. Which RBC protein is responsible for the biconcave shape? Biconcave shape. तो मतलब वो biconcave वाला shape is because of what? So remember, shape is because of spectrin. very good. First time there is hardly any error in this question because everyone ends up writing enchirin. अभी कुछ errors आ रहा है, never mind, जल्दी से याद कर लो. Enchirin हमारा favorite mutation है, हमारा favorite protein है, but everywhere enchirin is not going to fit. ठीक है? तो when we say shape, how do I find out the shape of a red blood cell? Shape is because of sp spectrin. But what you answered was enchirin. That is the mutation that is seen in hereditary spherocytosis. The most common mutation that you see in hereditary spherocytosis is enchirin. However, hereditary spherocytosis क्या है? Autosomal dominant है. Now they will change it. They will say, नहीं, you tell me if hereditary spherocytosis is autosomal recessive, then your favorite answer I'll take up. Then the answer is going to be spectrin. So can you see this change and how the confusion is created by the examiner? तो जल्दी से देख लो. What is the biconcave shape? Shape के लिए, normal shape के लिए spectrin. ठीक है? If they say hereditary spherocytosis, your favorite answer, that is enchirin. But if they change it to autosomal recessive, then that is going to be spectrin. Okay, what is the screening test for hereditary spherocytosis? जो ऐसा we've been reading it since ages. Either they will write it as Pink's osmotic fragility or just osmotic fragility testing. So they just ask you two questions. Which is the disease where there is high osmotic fragility and which is going to have low osmotic fragility? So remember, hereditary spherocytosis, hereditary high. So remember, hereditary spherocytosis has high osmotic fragility. High fragility matlab, if I say highly fragile, matlab highly weak, like all of us right now, our mental state is highly osmotic fragile. Highly fragile matlab a small trigger must also be causing a mental breakdown in all of us. Ho raha hoga na? That happens to everyone near the exam. Something like a pencil falling down also is going to create a trigger and you will be like, I don't want to study. So वैसा वाला, that is what is there. Hereditary spherocytosis has high osmotic fragility, है ना? And thalassemia cells are very tough. Thalassemia is tough, so that is going to have a low osmotic fragility. ठीक है? So like I said, this session is a lot about learning also and motivation also and relatable also, थोड़ा chit chat also, सब कुछ चल रहा है इस 1 hour में. Okay, so coming on, hereditary spherocytosis is high osmotic fragility, thalassemia is gonna be T for T, that is tough. But this was all screening test. What is the diagnostic test which you are expecting? Which staining? The EMA test. The EMA test, just in case exam में EMA नहीं लिखा, just in case they did not write EMA, they will write eosin 5 malamide testing. That means the same. Just don't get confused कि ये पढ़ा नहीं. Eosin 5 malamide is the same, okay? It's the same EMA testing and that is now the diagnostic. तो अभी तक ये जो osmotic fragility story that you were reading, that is all screening test. ठीक है? Everyone's okay with this? Can we move forward to another very very important riddle story almost towards the end? So like I told you ना, ऐसे Sachin जैसा we have to do century, but if you remember the gap between Sachin's 99th century and 100th century was quite huge. तो same way, बस हम जो end में आए हैं तो end वाला table is a little lengthy, after that तो हमारा century हो जाएगा. So quickly tell me, can you see or can you tell me the leukemia? And Dr. Nishchay, I'll take up your doubt after this. And now that I've shown this slide, तो पहले ख़त्म कर लेते हैं. Guess the leukemia. Child. Firstly, age is important. Child with more than 20% blasts. तो पहले तो everyone's given me answer ALL, very good. But सबसे पहले child में leukemia of course ALL होता है. But acute के लिए what is the cutoff? Always remember, for acute leukemia the blast cutoff has to be more than 20%. So yes, 20% blast है मतलब acute ही होगा. And pass positivity is seen for which blast? Pass positivity is seen for lymphoblast. So yeah, this is definitely a case of ALL. More than 20% blasts with pass positivity. ALL. अगला वाला तो ऐसी for formality I got. More than 20% blasts मतलब there is going to be acute with OR rods. OR rods मतलब मैम ये तो पता है, that is going to be AML, but एक थोड़ा advanced question बता दो. What are OR rods made up of? Which organelle is going to be there in OR rods? I will only answer this because so many times you guys must have done it in your subject wise and grand tests that you know it. OR rods are basically made up of lysosomes. So that is going to be AML. But now I am increasing the OR rods. I am saying there are OR rods which are crisscrossing. Crisscrossing of the OR rods is going to be seen where? It is seen in AML M3. Also, do you remember AML M3 is the only leukemia associated with DIC on this whole wide world planet. That is, only leukemia with DIC is AML M3. So AML M3 में ही दिखा lots and lots of OR rods. AML M3 is only going to show you this DIC. But can you tell me what is the name of this cell showing you lots and lots of OR rods? ऐसा क्रिस क्रॉस करता हुआ. What is the name of that very favorite cell? The name of that cell is the Faggot cell. Very good, excellent. Last, almost towards the end. Which is the only leukemia not associated with radiation? Not associated means every leukemia is associated with radiation but not this, and that is CLL. Very good. Someone has asked me Downs किसके साथ होता है मैम? डॉक्टर निकिता बताओ. Down syndrome. तो Downs का actually ना I cannot answer in one word. थोड़ा सा I will have to take up that doubt and everyone has a confusion. देखो everyone started answering AML M7. नहीं, सुनो ध्यान से. If they say Down syndrome में overall means they have not given you any age. बस पूछ लिया what is the most common leukemia in Downs. तो you will mark ALL. But if I say there is a particular age given of less than 3 years, then you will mark AML M7. ठीक है, तो बस पढ़ लेना एग्जाम में that what is the most common leukemia in Downs. Only this line is written, age नहीं लिखा, कुछ नहीं लिखा. Overall पूछा, I will mark ALL. But if given an age that is less than 3 years, some they say 18-month-old baby, 24-month-old baby, anything less than 3 years is given, then I will mark AML M7. ठीक है, okay with this question? Coming back, what are these two syndromes? So coming back to where we were, which is the one that is not associated with radiation? CLL. So CLL से related there are two syndromes that they will definitely ask you, and that is Evans and Richter's syndrome. ठीक है, तो जल्दी जल्दी बता दो. That is gonna be Evans. Evan मतलब everyone, like everyone is involved. Bone marrow में everyone कौन है? 3 people are there in the bone marrow: RBC, WBC and platelet. Everyone is gone. RBC में क्या हुआ? Autoimmune hemolytic anemia, RBC गया. WBC में CLL, blood cancer, and platelet में ITP. So everyone in the bone marrow is out. AIHA, CLL, ITP, RBC, WBC, platelet, सब लोग चले गए. That is Evans syndrome. What is Richter's syndrome? Richter is I wanna be, everyone wants to be rich. तो rich होने के लिए we will have to become some really hot shot Ambani kind of person, then only we will become rich. अभी तो we are छोटा छोटा NEET PG aspirants. Means when we are छोटा छोटा NEET PG aspirants, that is going to be CLL, SLL, small lymphocytic lymphoma. We are gonna be small lymphocytic lymphoma. But one day when all our NEET PG preparation will be over and we will be full-fledged practicing doctors, we will be very, very big people. Diffuse large B-cell lymphoma, we will become DLBCLs, and that day we will become very, very rich and knowledgeable. So what is Richter's syndrome? Richter's syndrome is when a small person becomes a large person, or small lymphoma becomes a large lymphoma, becoming very rich in life. That is Richter's syndrome. So remember, these last 4 days that you are studying is basically your conversion from SLL to DLBCL. ठीक है, that is what you are working towards in life. Soon in 4 days you are going to become DLBCL. तो बस उसके लिए पढ़ो. Coming to the last one, what is low lab score? Where do you see low lab score? So low lab score, तो even by ruling out you will tell me कि मैम अब तो CML बचा. So yeah, but now the examiner is not as nice na as all of us. So he will ask you the normal value of lab score. So jaldi please let me know what is the normal value of lab score that we have. Lab score, somewhere they will call it NAP score also. Lab score and NAP score, and that is going to be 4200. Ye to normal value I will have to learn. So if they say that the lab score has become small, it has become small, or small matlab I have learnt it. If it has reduced, to small matlab CML sounds like small na, CML sounds like small, so it is going to be reduced. Even in PNH it is reduced. Even in PNH it is reduced. Where is it increased? Can you tell me where is lab score increased? तो थोड़ा सा logic लगाना. What is NAP? Neutrophil alkaline phosphatase. So common sense, any disorder in which the neutrophil count will go up, the NAP score will also go up. Neutrophil कहाँ बढ़ेगा? Neutrophil increases in leukemoid reactions. Leukemoid reaction में neutrophil increases. Pregnancy में, gynae में तो very famous question obstetrics में, pregnancy में neutrophil count increases. OCP females, OCP usage females have increased neutrophil count. Neutrophilia patients तो obviously have increased neutrophil count. And even Down's syndrome has increased neutrophil count. ऐसा कैसे मैम, कैसे याद करेंगे? Simple, lakes and ponds, ये तो पहले भी करा है. What is lakes and ponds? Lakes and ponds means lakes for leukemoid reaction, P for pregnancy, O for OCPs, N for neutrophilia, DS for Down syndrome. Lakes and ponds में it is gonna go up, but the logic, just in case you forget lakes and ponds, your logic is that whenever the neutrophil count will increase, automatically the NAP score will increase. And sepsis, Dr. ZZZ and Dr. Nikita, yes, sepsis also, Dr. Anjali also says that, Sarik also, yes, sepsis is also neutrophilia only, na, bacterial infection also, matlab same thing, logic same hai, wherever the neutrophil count will go up, lab score will go up, theek hai. Now coming back, where is it going to be small? It is going to be CML and PNH have a reduced lab score. That is what I had asked you. कि low lab score कहाँ होगा? So they will not ask you like this. They will say the lab score is 20. The lab score is 10. Basically, they'll give you something below the normal value. Repeating normal value is 40 to 100. So less than 40 and more than 100. ऐसे question आएगा. Is that okay with everyone? Coming to almost the end. So like I said, this was a lengthy slide because last century से पहले तो there is always a wait, and yeah, all the doubts I will take after that. एक बार जो सोचा है पहले, let me just finish off and become like tension free. After that तो the house is open for as many doubts as you guys have. The last century of the day that you have, temperatures and shelf life, and you know this is very very important. तो बताओ temperatures. पहले you will tell me the temperature and for how many days can you store it. ठीक है? चलो. Whole blood and red blood cells, anything containing R for red blood cell को रेफ्रिजरेटर में रख देना. R for red blood cell को R for refrigerator में रख देना. Refrigerator, look at the refrigerator in your house or your hostel. The temperature is somewhere between 2 to 6 degrees. Random, मतलब overall the temperature is 2 to 6 degrees. But for how many days will you keep it? That is going to make a difference. So can you tell me for when will you keep it? For 21 days, 35 days, 42 days. कैसे कैसे याद करा? So everyone is saying 21, 35 randomly. Be more specific ना. If I have used ACD और CPD as anticoagulant, देखो कितने alphabets? ACD 3 alphabets, CPD anticoagulant 3 alphabets. तो 3 alphabets वालों में मतलब 3 weeks, 3 weeks मतलब 21 days के लिए I can keep. If I say CPD, I put a dash and A in front of it. देखो क्या है? CPD dash भी count करो and A. How many alphabets? 5 alphabets. मतलब for how many weeks can I keep the blood? 5 weeks के लिए I can keep the blood, 35 days. Then if I say CP Sagum, that is what all of you learn it as Sagum, but actually the name of the anticoagulant is CP Sagum. Count करो, CPSAGM, 6 alphabets means you can keep it for 6 weeks, 42 days. हो गया याद. If I have the anticoagulant as ACD and CPD 3 alphabet तो 3 weeks, CPD dash A 5 alphabets or characters तो 5 weeks and CP Sagum में 6 weeks. तो this is simple, but the temperature is same. RBC है तो refrigerator वाला temperature. Coming to the next, platelet rich plasma or anything to do with platelet, this is kept at a 20 to 24 degrees for 5 days, and the story doesn't end over here. With continuous agitation, मतलब forever, for 5 days, left right, the platelet bag keeps moving. You can never stop it. Why? If you stop it, तो platelet ऐसा clot बना देगा. It's gonna make a clot. You don't want it. So keep moving the bag. So since this is, you will realize 20, someone saying room temperature, yeah, kind of. 20-24 is quite a high temperature. So don't you think if I ask you which bacteria or which product of blood is maximally at a risk of bacterial contamination, so you will say that ma'am, the bacterial contamination will always occur or growth will occur at a high temperature. This is the highest temperature that I am seeing. So bacterial contamination and growth will be maximally in a platelet. ये भी question है ना? ठीक है. Now finally, fresh frozen plasma, FFP, the name only has it frozen. Frozen matlab it is gonna be less than -30, and anything frozen food can be kept for very very long na. It is kept for 1 year. It is kept for 1 year. But now ये तो everyone on this planet knows this table. Nothing new. Examiner will give you twists and turns. He will say you know those questions na. When the examiner makes you an intern or a resident, you are an intern and this problem has happened. How will you solve it? So you are an intern and this agitator wala machine stops working. You are an intern and the freezer stops working. So now what is gonna happen? Remember, if the agitation wala machine stops working, और this melts, melting को बोलते हैं thawing, melting of fresh frozen plasma is known as thawing. Everything shelf life drops to 1 day. Means if the agitation is not happening, now you can't store platelets for 5 days. Now the shelf life of platelet is 1 day. So basically I have learned कि कोई भी problem हो गया ना, everything comes down to 1 day. Simple, if the fresh frozen plasma has become water, मतलब melt हो गया, then what is the shelf life? 1 day. तो सब कुछ 1 day, 1 day, 1 day हो जाएगा if a problem happens. ठीक है, everyone's okay with this? So that of course is the last one, and last century पर तो everyone, और 100th पे तो you always look towards God, and this is all of us right now, because we are looking and praying towards God that we should get like the best possible result in the NEET PG exam, which I am very confident. मतलब whatever little doubts that even I had na before the session, my doubts have gone away. For me, you guys are going to emerge as winners as far as pathology and even other subjects are concerned. Thoda sa let me test your microbiology also. So tomorrow at 5 o'clock we'll be meeting for micro. PDF ke liye you will have to give me 5 minutes, because immediately I am gonna talk about the PDF. Now we'll take up any doubts that you have. So if they are microbio doubts, we'll save them for tomorrow. If they are pathology related doubts, so definitely the house is open. Someone had asked me about PNH. I had promised you about PNH in the end. तो जल्दी जल्दी PNH का तो simple question है ना. Paroxysmal nocturnal hemoglobinuria is what? It is which of the CD markers are a problem? It is CD 55, 59 that is a problem. ये तो पता ही है, that is absent. And the expected question, let me tell you, for paroxysmal nocturnal hemoglobinuria, they will ask me what all can the person have. बस 3 questions याद कर लो. Complications क्या होता है, right? Complications होता है that firstly the patient can have thrombotic episodes. Thrombotic मतलब cerebral vein thrombosis, hepatic vein thrombosis, thrombotic episodes, एक चीज़. Second, bone marrow ना it becomes very weird in PNH. So bone marrow basically becomes bipolar. Either the bone marrow says I am not going to work at all, or the bone marrow says I am going to work a lot. So I am not going to work at all matlab bone marrow says I am going into aplastic anemia. I will not work at all. The other spectrum is bone marrow says कि अब तो इतना काम करेंगे that I will become a leukemia, I will become AML. So simple, bone marrow का अपना अलग mood swings चल रहा है. Either bone marrow doesn't work at all or bone marrow becomes a leukemia. That is what happens in PNH, and it is CD55, CD59 का defect. That is also sorted. PNH का main questions हो गया. Anything else that Budd-Chiari syndrome, Dr. Adiba, you are saying perfect. That is hepatic vein thrombosis. That is also done. Mycosis fungoides, Dr. Noshin, you tell me mycosis fungoides. Next doubt, guys. Mycosis fungoides actually क्या होता है? It is a T cell NHL ना. So all the T cell markers will come under it. अभी जितना T cell markers पढ़ा था 1 to 8, 28, any TL marker will come into this. What we Acha, one by one I am going through the doubts. Mnemonic for blood cancers, Dr. Chirag, obviously these were all shorter sessions. If you want to look into detailed sessions, app par to hai hi, and otherwise even if you look at the YouTube sessions of Jan and Feb, you will be able to find the blood cancer. January session mein blood cancer has been done in detail. Next, integrin selectin ho gaya na, Dr. ZZZ. Integrin selectin, go to the first part of this particular session only, you will find. Someone said Potrier's microabscess. Bilkul, mycosis fungoides shows you Potrier's microabscess. What are the anticoagulants in red blood cell? Abhi pada, we've done na, ACD, CPD, CPDA and CP-SAGM. These are all the anticoagulants that we have. Yes, Dr. Anu, for FMGE that will be enough. Yes, the crash course that you're talking about. Dr. Alfia has a question. Difference between Viscot and hyper IgM. नाम में ही पता लग गया. Hyper IgM में which antibody is going to be more? Hyper IgM. IgM will be more. And Viscott-Aldrich syndrome में the first antibody to go down is IgM. The first word is only a difference over there. ठीक है. Gleason, Dr. Hemant, you can do Gleason scoring, although it's more important for INI-CET. तो NEET के लिए keep it lower down in your priority list. Focus on other topics, and if time permits, you can go through Gleason. Okay, hang on. One by one, I'm coming to queries. It's just become flooded हो गया है, so I'm trying to read through everything. ग्लीजन स्कोर में व्हाट इज़ इंपॉर्टेंट, डॉक्टर आदित्य एक क्वेश्चन कर जाओ, क्रिब्री फॉर्म पैटर्न कौन सा वाला पैटर्न होता है? क्रिब्री फॉर्म, क्रिब्री फोरम, दैट इज हाउ वी हैड लर्नड, क्रिब्री फोरम इज पैटर्न नंबर 4, बस उतना तो यू हैव टू नो, अदरवाइज if you get time in the end, go through it, but it's lower in the priority. It's more important for your INI-CET. Alport syndrome versus good pasture syndrome, very simple. Someone's asked me, good pasture syndrome में which alpha chain was affected? Alpha chain was alpha 3, whereas Alport पढ़ो alpha Alport. When we say Alport, it is going to be alpha penta, alpha 5 chain is affected. ठीक है, चलो नेक्स्ट, ब्लड ट्रांसफ्यूजन रिएक्शंस में द मोस्ट इंपॉर्टेंट दैट यू नीड टू नो एट दिस पॉइंट ऑफ टाइम इज I'll write it down. It is going to be febrile non-hemolytic transfusion reactions. Those are the most important. Febrile non-hemolytic transfusion reactions, which are going to be seen whenever WBCs are present. So that is the reason कि हम WBC नहीं रखते. What do we use? We always give leuko-reduced. We give leuko-reduced red blood cells. We remove the WBCs because WBC से the febrile patient has fever. Febrile non-hemolytic transfusion reaction is gonna be there. And some of the things that you are telling me, guys, immunofluorescence, look at the rapid review na please. Immunofluorescence discuss hua hai, CK720 discuss hua hai. So anything that was not discussed in this session that is of course important, wo lengthy wala jo tables, please go to the Jan 30th and 31st wala sessions that are available on the same YouTube channel and you will find those. So those sessions I think total they are 3 hours, 2x ki speed pe 1.5 hour. Wo dekh lo, that is like your go-to thing now for whatever things you're missing out on the tables of immunofluorescence, or maybe you know some pictures of nephritic, nephrotic, or maybe some cancers. That rapid review is gonna take the most important thing. Patho FMG session of course hoga, but at the right time. Abhi first we'll focus on the NEET exam and after that we'll come to INI-CET and FMG. Lifespan of RBCs in different situations ho gaya, that is what we've done. Dr. Amirtha, pruritus, aquagenic pruritus is what you're asking me, polycythemia vera. So polycythemia vera mein aquagenic pruritus is aquagenic after hot water bath. That is basically seen because there are lots of mast cells that polycythemia vera has. So when hot water falls on the skin, all the mast cells are gonna burst. Mast cells burst means what comes out? Histamine comes out. Histamine comes out, matlab patient has itching. So it is aquagenic pruritus, pruritus after a hot water bath. Okay, Nestrov test, Dr. Pathan had asked. Nestrov test is done of course for screening of thalassemia. Thalassemia ka screening ke liye. It is not a diagnostic test. So just know, I don't have a picture, I was not expecting that doubt. So just know, if you see the background line, background mein jo black wala line hota hai, means that is going to be a normal sample. And in Nestrov, when you don't see the background wala line, when that is absent, that is when you start suspecting a case of thalassemia. So remember, thalassemia mein lines are absent. That is how we are going to learn it. Lines are absent. Okay. Dr. Mohan Raj, basophils release histamine in polycythemia vera. Basophils and mast cells are said to be bhai. They are said to be cousin brothers. So basophils and mast cells both increase in polycythemia vera. Okay. ठीक है, I will try my best that we can accommodate a lot of you. Trally, yes, trally within 6 hours, taco within 12 hours, that is correct. Dr. Anu, nahi, primarily हमेशा full course होता है. Crash course is something that will help you in the last 1 month, like right now. Right now you can't do a full course, so abhi to crash course, but in the starting of course a full course is gonna be there. General micro, kal, we will take care of general micro, guys, don't worry. Right? And any other, what you can do is probably you can, if you still have any, someone had asked me about emphysema, someone had asked me about immunofluorescence patterns. Guys, ये सब पहले हो चुका है. I don't have pictures right now because this was more of a one-liner wala session, but all this has been conducted. Like I said, just go to the Jan 30th and 31st wala session once. Go through those, PDFs are there on the Telegram group, the links are there on the YouTube channel. एक बार उसको देख लो. The remaining part of it is also sorted for you. उससे भी ज़्यादा time है, go back to the early January sessions on the YouTube channel, then there's no end. And I would never recommend that. Not by being selfish, I would say watch all my videos, because pathology is not the only subject that you have to study. So you have to be very, very concise in every subject. Now you can give 3-4 hours to every subject. So priority mein dekh lo. Look at this session, look at the Jan 30-31st session, that occurs on priority basis, right? Okay, so as I just want to end it on what I started with, and that is please stay strong. And easier said than done, but I guess together, by the reason that I kept these classes towards the end was that I know that at this point of time studying on your own becomes quite a task. So as I said, that together we will definitely reach somewhere, right, and reach a good place, which I'm very, very confident about. So study well, all the very best. See you all tomorrow for the micro session at 5 p.m. A similar breathless rapid review session coming up your way tomorrow as well. Thank you guys. God bless.